Probiotics, I think, have had bad press. Everybody knows about antibiotics, and people respect that, and they're medically prescribed. Probiotics are being perceived somewhat like voodoo. It's something you go into a health food store and you grab off a shelf, you throw it down and you hope for the best. And I think that's really been bad. It's been driven by the market. Because those probiotic bacteria, if you choose the right one for the right disease, for the right condition, then it's likely to be very beneficial, just the same as an antibiotic. And that's what we're trying to do. We're trying to take away the approach of just grabbing something off the shelf, throwing it down and saying, yes, it works, or no, it doesn't. And I think generally probiotics will not do any harm. I think at best the placebo effect would have some sort of effect that you're actually doing something. In terms of the reality of it, the mechanism is really very complex with probiotics. They differ from organism to organism. There are some 36,000 organisms living in the intestine. Many of those can be engineered, so the scope is enormous. So the chances of one person picking the right one straight away would be very, very slim without any sort of strategy, which is what we're doing. So, for example, the one I've just presented here is an organism known as Streptococcus thermophilus Th4. This is an organism which secretes folic acid, so it can be used to try and ameliorate methotrexate damage, which is one of the chemotherapy drugs. So it's again a case of aligning a clinical problem with an appropriate probiotic, and that's where we come in.